This is our 6th annual summit. We had the highest number of attendees that we've ever had.
What's truly amazing is to see the growth and development of our telehealth system in the state. And I think the summit now in its 6th year is a nice reflection of that as far as we look at the range of presentations and topics being covered, and actually including the fact that we're sharing success stories from across the state, both in how we're improving access to care, improving the patient care experience, but also now being able to demonstrate how much we're improving the quality and outcomes of care.
We cross paths a lot. We have work groups that we work together. We have formal structure we work together. We have informal structure we work together. I think it's important here to sometimes put a little bit of that work down and realize that we're all playing in the sandbox together. We're not a huge state and we need each other. And to me, sharing our successes, learning about what each other are doing, and just reminding each other that we're all humans and have the same goals in mind of using these tools wisely. It's really all about relationships and collaboration.
We had the ATA president, Dr. Yellowlees, here.
The bottom line with all of this is if you actually do the calculation, the individual physician working in the way that I work can actually monitor and treat and manage, at least twice as many patients as the individual physician who just sees patients in person all the time.
It was significant to know that we have all 5 of our telehealth hubs as platinum sponsors, which shows you that each of the health systems in the state are now contributing financially to the summit because they think it's important. We learned about the world's largest telemedicine network, which is in Ontario, and I think it gave us a way to set goals for ourselves on things that we could look to accomplish.
We may run similar programs, a telestroke or a tele-ICU, a telepsychiatry, but there are a lot of good insights in some of the barriers, some of the success stories.
Getting like-minded people together to try and think about ways to use telehealth to improve the lives of South Carolinians is important. There's a halo effect when you have like-minded people all discussing opportunities, strategies, tools, techniques, etc., to ways to better serve our patients and our communities.
And I think to come to a statewide conference and let other people motivate you and encourage you, I think we need that annual visit and that annual piece of motivation and building them up to keep them going and keep them working in those communities.
And I kind of look at it like the new year for telehealth. After this, we go out and conquer. We have a new strategic plan that gets blessed for the calendar year. So it kind of happens in the spring. We get back together, we have a little celebration, and then we go back to our corners and do as much work as we can.
I think one of the most important things that we learned is that there is a lot of passion and motivation, and folks want to help others. They want to focus on the patient, and I think that room was full of telehealth champions, and I think they sort of decided to rise to the occasion, and I think they'll go back and do great work from what they learned.